So management of patients with type 2 disease is quite variable depending on where you live in the world. And that's a little bit down to different approaches that different cultures take and different doctors take to managing this disease. And it's also a little bit more patient specific, because the way the disease can affect a patient can be quite varied. The diagnosis can take quite a long time. So sometimes you meet a patient and you make the diagnosis quite close to end of life, really, for that patient. And so your management options are very limited at that point in time, and care really needs to be supportive. And all care for type 2 infants should be directed, really, in my opinion, at supportive management in a situation where we have no definitive disease modifying therapy. So we don't have a treatment that we can give that's going to change this disease at the moment. And so different teams around the world do different things. Our typical practice in the UK would not be to offer specific Gaucher therapy. So we wouldn't typically start these babies on enzyme replacement therapy. We would offer interventions that may improve symptoms, and we would focus on symptom control and symptom management. In some places, and depending on at what point you're diagnosed, some children have procedures to support them, so feeding tubes or tracheostomies, which can in certain circumstances be helpful, but sometimes they can prolong life without improving quality of life. So really the landscape at the moment is very stark when it comes to therapeutic changes that we can offer these babies.